The call for a herd immunity approach to tackling the coronavirus has been dividing opinions lately. There have been open letters published on both sides of the debate. But what is herd immunity? Well, it's the idea that a population can be protected from a virus if enough people in the community develop immunity, either through vaccination or exposure. The immune members of the herd protect those who have not yet been exposed. Proponents argue that because most people who are infected by the coronavirus suffer no symptoms, let alone become ill or die, the virus should be allowed to run through the community unchecked, while vulnerable people are protected. Critics, and that includes the World Health Organization, argue that with a death rate of about 0.6%, encouraging the virus to spread would lead to an enormous number of deaths. Well, let's get more on this now with Dr. Tom Frieden. He's president and chief executive of the U.S. group Resolve to Save Lives and former head of the U.S. Centers for Disease Control and Prevention between 2009 and 2017. Sir, it's a real pleasure to have you here on Al Jazeera. Thank you so much for joining us. You join us live from New York. So you've heard, I guess, my explanation there. Where do you stand on the role of herd immunity? Do you think there is a role for it in the various countries' approach to dealing with COVID-19?
First, let me make something clear. This is not a scientific disagreement. There is close to unanimity that the idea of letting the infection run rampant and protecting the vulnerable is a delusion. It's a dangerous idea. It is bizarre, it is not scientifically supported, and it would result in hundreds of thousands of preventable deaths in the United States and millions of preventable deaths globally. You know, you see this often. You saw it with tobacco, you see it with climate, where you have 99 scientists saying one thing and one scientist saying another. And on the news, it's 1-to-1. But the fact is that herd immunity can occur with an effective vaccine. But trying to get to herd immunity through natural infection would mean getting there through graveyards filled with hundreds of thousands or millions of people who did not have to die.
I mean, you say 1-to-1. In fairness, we're only speaking to you for your view on this. So in light of that, why do you think it keeps on being mentioned? Do you think it is often a genuine misunderstanding? Because, as you say, herd immunity works when people are vaccinated. And even then, I think it's around 90% of the people that need to be vaccinated for it to be effective. Or do you think it's being used as a bit of a political ploy by governments that simply don't want to give unpalatable options?
There's an old saying that for every complicated problem, there's a solution that is quick, simple, and wrong. And when it comes to COVID, this idea of letting it run rampant and protecting the vulnerable is that wrong idea. It's wrong for a few reasons. First, in order to get to herd immunity, no one knows what proportion of people would have to become infected, 60, 70, 80% or more. No one knows how long immunity lasts in people who are infected, or what proportion are immune. But in the US, we've already had more than 215,000 deaths, and that's with about 10 or 15% of people infected. So multiply that by 4, 5, or 6, you're talking about hundreds of thousands or a million more deaths to get to herd immunity. Furthermore, the concept that we can protect the vulnerable is just deeply mistaken. In the US, nursing homes have been hard hit, but only 3% of people over the age of 70 live in nursing homes. People live in multi-generational families. We're all connected. And the more we recognize that we're all connected, the more we recognize that the only way to protect the vulnerable is to protect all of us, to reduce the spread of COVID. And we can do that with a twofold approach: reduce the number of infections and then clamp down on infections when they do occur. You reduce infections by wearing a mask, washing your hands, watching your distance, and reducing risky indoor exposures. And you clamp down on it by a strategic testing approach that rapidly isolates patients so they don't spread it, that warns contacts so that they don't spread it to others. And countries all over the world, including many in Africa and Asia, have done this successfully. We need to do it in the US. Europe is struggling, as you mentioned earlier, with a big resurgence now. Both of those measures are needed. There's no one thing, not even a vaccine, is going to make this virus magically disappear. There's no fairy tale ending here. We're going to have to learn to control it by working together and recognizing that we really are all connected.
We have seen, as you mentioned, in countries right around the world, the infections rise, even perhaps some European countries that took to wearing masks and distancing relatively easily, to other countries like the US, perhaps, that were a bit more resistant. Do you think that a rise in infections was inevitable because society started opening up? Or do you think that people really still haven't got the message about distancing and masks and how crucial that is?
I don't think it's inevitable that we'll continue to see increases. I think we're continuously learning more about how we can control the virus. The more we learn about masks, the more it seems they not only protect other people, they may protect ourselves, they may even protect you against severe illness if you do get infected. The more we understand where it's spreading, the more we can reduce that. In the US, we are seeing spread at social events, weddings, funerals, social get-togethers in college campuses, fraternities and sororities. So the more we can find out where it's spreading and control it there, the more we can allow other parts of society to open. We do want to get social activities back, particularly in-person learning is so important for students, particularly lower income students. So we agree in public health with the need to manage the virus so we can manage our economy. We can't ignore the virus and expect to be able to reopen our economy.
Are you worried by the current situation, I suppose in the US, but really around the world?
I am. We are not in control. There are wonderful success stories from countries all over, Europe, Asia, Africa, where you've seen countries that have been guided by public health and have supported public health have been able to keep cases low and get their economy back faster. And that's the approach we need everywhere, whether it's Iceland or Germany in Europe, where you see very effective programs, or Senegal, Uganda, Rwanda, Ethiopia in Africa, or Taiwan, Hong Kong, South Korea in Asia. There are, or Australia and New Zealand. There are really good examples all over the world. This is doable, but it takes all of us working together, but staying apart.
Dr. Tom Frieden, President and Chief Executive of the U.S. group Resolve to Save Lives and former head of the U.S. Centers for Disease Control and Prevention. Sir, it's been a real pleasure to have you share your views with us here. Thank you.
Thank you so much. Nice speaking with you.